Iraqi Health announces the country's entry into a more severe and dangerous epidemic. Confronting the new wave requires focusing on prevention methods. The Iraqi Ministry of Health announced the country's entry into a third epidemic wave while indicating the continuation of the plan to increase the quantities of vaccines and immunization outlets. The spokesman for the Ministry of Health, Saif Al-Badr, told the Iraqi News Agency on Saturday that the new epidemic wave that entered the country is more severe and dangerous than the first and second waves which entered the country previously. Al-Badr stressed that confronting the new wave requires focusing on prevention methods, the most important of which are wearing masks and special distancing, as well as vaccination. He added that the Ministry of Health began implementing an expanded plan that includes increasing the quantities of vaccines delivered and the number of vaccination outlets in Baghdad and the governorates. Iraqi medical specialists warn that Iraq will turn into a hotspot for mutations of the coronavirus due to the lack of people's desire to receive the vaccine and due to the continued spread of infections at a high rate and the neglect of preventive measures. In a previous report to Al-Hurra, the doctor who specializes in monitoring epidemics, Ghassan Aziz, said that Iraq may turn, in light of the lack of vaccinations, into a country in which various mutations of the coronavirus are nurtured. This means that the Iraqis will be at risk of exposure to more dangerous versions of the virus and also to exposing the countries and the region and the world to the risk of mutations.